Gentlemen, today we're going to talk about a subject that many men think about, but very few feel comfortable discussing. If you're over 55, you've probably wondered at some point what really happens to your body after going a long time without sexual activity. Perhaps you've been living alone, your partner's health has changed, or life has simply become so busy that intimacy is no longer part of your routine. Whatever the reason, you've likely heard people say, if you don't use it, you'll lose it. But is that actually true? Or is it just another myth that keeps men worried? I'm Dr. Leah, and for more than 15 years, I've helped men understand and improve their urological health. One thing I've learned is that there's a tremendous amount of misinformation surrounding this topic. Some people believe your body quickly stops functioning without regular intimacy, while others claim nothing changes at all. The truth lies somewhere in between. In today's video, I'll explain exactly what modern medical research tells us. We'll separate fact from fiction, explore the real biological changes that can occur during long periods without sexual activity, and most importantly, discuss what you can do to protect your health and vitality regardless of your current relationship status. Before we get into the science, let's clear up two of the biggest myths I hear from patients almost every week. The first is the belief that if you stop having sex for a while, your body will permanently lose its ability to function. That's simply not how the male body works. Your blood vessels, nerves, muscles, and hormones are far more resilient than most people realize. The second myth is that taking a long break means your sexual desire will disappear forever. Thankfully, that's not true either. While desire can fluctuate because of age, stress, health, or emotional factors, the body has an incredible ability to recover when the right conditions return. Now that we've cleared away those common misconceptions, let's talk about what actually happens inside the body during an extended period without sexual activity. The changes are real, but they're often much less dramatic than people imagine. More importantly, many of them can be improved or even reversed with healthy habits. Think of your reproductive system as relying on three essential foundations. The first is healthy blood circulation, the second is strong pelvic muscles, the third is balanced hormone function. When these three systems are working together, they support not only sexual health, but also bladder function, energy levels, and overall well-being. During regular sexual arousal, fresh oxygen-rich blood flows into the tissues of the pelvic region. That steady circulation helps nourish the tissues, keeping them flexible, healthy, and responsive. It's similar to how regular movement keeps your joints from becoming stiff. The body performs best when it's used consistently. At the same time, the muscles that support your bladder and reproductive organs become active. Every climax naturally exercises these pelvic floor muscles, helping them remain strong. Those muscles are responsible for far more than sexual performance. They also contribute to bladder control, posture, and core stability, especially as men grow older. Hormones complete the picture. Testosterone influences much more than libido. It affects motivation, muscle maintenance, mood, confidence, and overall vitality. While sexual activity isn't the only factor that influences hormone health, it does interact with these natural processes in meaningful ways. So what happens when intimacy becomes less frequent for months or even years? Does everything begin to decline? Not exactly. Your body doesn't suddenly stop functioning, but certain changes can gradually develop over time. Understanding those changes is the key to preventing unnecessary problems, which is exactly what we'll explore next. Let's begin with the first real change, and it involves something most men never think about until they notice a difference. Dr. Leah calls this the blood flow effect. The tissues of the penis depend on a steady supply of oxygen-rich blood to remain healthy and flexible. Every natural erection, including the ones that occur while you sleep, helps nourish those tissues by stretching them and keeping them responsive. In many ways, your body performs its own routine maintenance without you even realizing it. When erections become less frequent over a long period, those tissues receive less of that regular circulation. This doesn't mean they suddenly stop working, nor does it mean permanent damage has occurred. Instead, some men notice that erections may not feel as firm at first, or they may take a little longer to develop than they once did. I often compare it to taking a long break from exercise. Imagine not stretching your muscles for several months. The first few workouts might feel tight and uncomfortable, but with regular movement, flexibility gradually returns. The same principle applies here. Your body responds remarkably well when healthy circulation is restored. During my 15 years of treating men of all ages, I've seen countless patients become anxious after noticing these temporary changes. Many feared something serious was wrong when, in reality, their bodies were simply adapting to a period of reduced activity. The encouraging news is that for most healthy men, these changes are reversible. As regular blood flow returns through natural arousal and healthy lifestyle habits, tissue responsiveness often improves significantly. That's why understanding what's happening biologically can replace unnecessary fear with confidence and allow you to focus on supporting your body's natural ability to recover. The second change involves a group of muscles that most men rarely think about until they begin causing problems. Dr. Leah refers to this as the pelvic floor effect. Hidden beneath your bladder is a network of muscles that plays a vital role in everyday life. These muscles help support your bladder, assist with bowel control, contribute to erections, and are heavily involved during orgasm. Like every other muscle in your body, they perform best when they're used regularly. When sexual activity becomes less frequent over an extended period, these muscles may gradually lose some of their strength and endurance. The change usually happens so slowly that many men don't notice it right away. Instead, they begin experiencing small warning signs. Perhaps they rush to the bathroom more often than they used to. Maybe they notice a slight urine leak after coughing, laughing, or lifting something heavy. While these symptoms can have several causes, weakened pelvic floor muscles are often part of the picture. Over the past 15 years, I've reassured many men who believed these changes meant they were simply getting old. The reality is much more encouraging. In many cases, the muscles have simply become weaker from lack of regular activation, and like other muscles, they can often become stronger again with consistent training. One of the simplest ways to rebuild this strength is by practicing pelvic floor exercises, commonly called Kegel exercises. These involve gently tightening the same muscles you would use to stop the flow of urine, holding the contraction for a few seconds, and then relaxing. Just a few minutes of practice each day can gradually improve muscle tone, support better bladder control, and contribute to overall pelvic health. The important thing to remember is this: weakened muscles are not the same as permanently damaged muscles. With patience and regular exercise, many men notice meaningful improvements, proving once again that the body has an impressive ability to adapt and recover. The third change is one that many men mistake for simply getting older, when in reality there's often much more happening beneath the surface. Dr. Leah calls this the hormone balance effect. As men age, testosterone naturally declines little by little. That's a normal part of life. However, your hormonal system responds to many factors beyond age alone, including physical activity, sleep quality, nutrition, stress, and sexual health. These systems constantly communicate with one another, influencing how you feel from day to day. When a man goes through a prolonged period without sexual activity, some begin noticing subtle changes. Their energy isn't what it used to be. Motivation becomes harder to find. Everyday tasks feel more exhausting, and the desire for intimacy slowly fades. Unfortunately, this can create a cycle that's difficult to recognize. Less desire leads to less activity, and less activity may make that desire diminish even further. During my 15 years of treating men, I've had many patients tell me they no longer felt like themselves. They weren't just concerned about their sex drive, they missed their confidence, enthusiasm, and sense of vitality. Many assumed these feelings meant their best years were behind them. The encouraging news is that these symptoms don't always indicate permanent hormonal decline. In many cases, improving overall health can help restore balance. Regular exercise, especially resistance training, quality sleep, maintaining a healthy weight, reducing chronic stress, and eating a nutritious diet all support healthy testosterone production naturally. If these symptoms become persistent or begin affecting your quality of life, don't simply accept them as an unavoidable part of aging. A simple medical evaluation can determine whether your hormone levels are where they should be. When an imbalance is identified, effective treatments and lifestyle changes are available. The sooner you understand what's happening, the sooner you can take meaningful steps toward feeling stronger, healthier, and more like yourself again. The fourth major change has less to do with the body and much more to do with the mind. In my experience, this is often the change men struggle with the most. Dr. Leah calls it the emotional well-being effect. Sex isn't simply a physical act, it's closely connected to emotional health, stress management, sleep quality, and our sense of connection with other people. During moments of intimacy, the brain releases chemicals that help promote relaxation, strengthen emotional bonds, and improve overall mood. When intimacy is absent for an extended period, many men notice changes that go far beyond the bedroom. Some describe feeling more isolated, while others find themselves becoming unusually irritable or anxious. Sleep may become less refreshing, and everyday stress can seem harder to manage. If a man is in a committed relationship, the absence of physical closeness may slowly create emotional distance as well, making communication more difficult over time. Throughout my 15 years in practice, I've spoken with many men who believed something was wrong with them because they no longer felt the same emotionally. What they didn't realize was that prolonged loneliness or lack of affection can affect mental well-being just as much as physical health. The important message I want you to remember is this: these feelings do not define your worth as a man. They are a normal human response to changing circumstances, not a sign that you've somehow failed. The encouraging news is that reconnecting with others, improving communication, staying socially active, exercising regularly, and addressing emotional concerns early can make a remarkable difference. Your emotional health deserves the same attention as your physical health. When both are cared for together, confidence grows, relationships become stronger, and overall quality of life improves in ways many men never expect. Now we've reached the most important part of today's discussion. After hearing about these changes, many men immediately ask me the same question: Dr. Leah, are these effects permanent? Thankfully, for the vast majority of men, the answer is no. One thing I've learned over the past 15 years is that the male body is incredibly adaptable. It responds to the way you treat it. When healthy habits return, your body often begins improving far more quickly than you expect. Better circulation can restore tissue health, stronger pelvic muscles can improve bladder control, balanced hormones can increase energy and desire, and emotional well-being can gradually return through meaningful connection and a healthier lifestyle. Of course, every man is different. If you have conditions such as diabetes, heart disease, obesity, or significantly low testosterone, recovery may require additional medical support. There's absolutely no shame in seeking help. In fact, asking for help is often the smartest decision you can make because many of these conditions respond well to modern treatment when they're addressed early. Whether you're currently sexually active or not, there are 4 simple habits I encourage every man to practice. Stay physically active through regular walking and strength training to improve circulation. Perform pelvic floor exercises each day to keep those important muscles strong. If appropriate for your situation, maintaining normal sexual function through self-stimulation can also support healthy blood flow and tissue function. Finally, don't ignore persistent fatigue, low mood, or declining libido. Speak with your healthcare provider and have your hormone levels evaluated if necessary. Before we finish, I want to leave you with one final thought. Never measure your value as a man by how often you have sex or by your sexual performance. Your character, your wisdom, your resilience, and the way you care for yourself and those around you define who you are far more than any physical function ever could. Take care of your body, stay proactive about your health, and remember that growing older does not mean giving up your vitality. With the right habits and the right knowledge, you can continue living with strength, confidence, and purpose for many years to come.